You know that feeling when your eye gets irritated, maybe red, a bit itchy, that familiar pink eye we all know. But what happens when that same sort of thing affects a horse? You know, these huge animals that can't just tell us what's wrong. Suddenly what looks like simple pink eye, well, it can be a much bigger puzzle. So our mission today really is for you. We're going to take all this detailed info we've gathered and do a real deep dive. We want to pull out the key bits of knowledge about, what causes equine conjunctivitis, how you can spot it, and really importantly, how to handle treatment the right way. Think of it as your shortcut to getting up to speed.
And that shortcut is pretty vital, actually, because while it might look like just surface irritation conjunctivitis in horses, it can often signal much more serious underlying health problems. Problems both in the eye itself and sometimes systemically, throughout the horse's body.
Okay, so let's unpack that. When we talk about conjunctivitis in horses, what exactly are we referring to?
Essentially, conjunctivitis is an inflammation of that pink lining you see in the eye. That's the mucous membrane on the inside of the eyelids. Vets call it the palpebral conjunctiva, and it also covers the surface of the eyeball itself, the bulbar conjunctiva. And it includes the third eyelid, too, the nictitating membrane. But what's really fascinating, and kind of the core point here, is that conjunctivitis is what we call a non-specific finding.
A non-specific finding. So it's almost like a fever that tells you something is wrong, but not specifically what is wrong. That feels like a really important aha moment for understanding this.
Exactly right. It's a symptom. It's not the diagnosis itself, which means it can stem from a really wide range of things, anything from just a bit of dust in the eye to, complex eye diseases, issues with the structures around the eye, or even systemic illnesses like anemia or jaundice. It's actually pretty common in horses. But because it's so nonspecific, you always need a proper investigation.
Right. Common, but tricky. So given that, what should we, as horse owners or maybe just enthusiasts, really be looking for? What are those, visible clues that tell us this looks like conjunctivitis?
Well, the main signs really reflect that irritation and inflammation. First thing you'll probably notice is redness. Vets call it hyperinrenia. That pink lining and sometimes even the white part of the eye, the sclera, just looks obviously red or pink. Then there's often swelling or ecchymosis. That's where the conjunctiva itself gets puffy. Sometimes it almost looks like it's bulging out a bit. The eyelids can look swollen too. And of course, ocular discharge. This can vary a lot. It might be clear and watery, that serous discharge, which you often see early on, or maybe with foreign bodies or allergies. It could be thicker, maybe clear or grayish. That's mucoid discharge. But if you see yellow or green discharge, something that looks like pus, that's mucopurulent or purulent discharge, and that's usually a big flag for a bacterial infection being involved.
Okay, redness, swelling, discharge, got it. And what about signs that tell us the horse is actually uncomfortable, in pain? Because seeing a red eye is one thing, but knowing they're hurting, well, that changes things.
That's a really key distinction, absolutely. You need to look for squinting. The technical term is blepharospasm. They might also show photophodia, which just means sensitivity to light. So they'll squint more in bright conditions. You might actually see the horse trying to rub the eye, maybe on their leg or a fence post, anything really, or even head shaking, trying to get rid of that irritation. And often you'll notice the third eyelid protruding more than usual. It often becomes more visible when there's discomfort or swelling deeper in. Now, things get more serious if the cornea, the clear front window of the eye gets involved. If you see a bluish haze on it, that's corneal edema or swelling. Or if you see actual ulceration, like a divot or new blood vessels growing onto it, those are signs of a much more severe condition. Needs a vet, immediately. And sometimes, though less common, there can be really unique appearances, like thickening around the edge of the cornea in onchocerciasis, or maybe proliferative masses or ulcers with squamous cell carcinoma, or little granulomas with habronomyosis. Anything really odd warrants a call.
Wow. Okay, so this is where it gets incredibly interesting, isn't it? Because if conjunctivitis is so nonspecific, the list of potential causes must be huge. Like you said, dust, parasites, even cancer.
Absolutely. It's a vast range. We can kind of broadly split the causes into non-infectious and infectious groups. And actually, the non-infectious causes are the most common culprits. Think about everyday environmental irritants. Dust and dirt are huge ones, especially if you're in a dry, dusty area or the horse is in a stall with dusty bedding. Pollen is a big one for seasonal allergic conjunctivitis. Even tiny bits of hay or grain can get in there and cause irritation. Ammonia fumes from stalls with poor ventilation can definitely irritate the eyes. And flies. Flies and other insects are a major factor, direct irritation. Plus, they can cause tiny scratches, microtrauma.
Right, the environment plays a huge role.
It really does. Then there's physical trauma. Could be a foreign body, like a grass seed or a bit of chaff stuck under the eyelid, or self-trauma from rubbing too hard, or just a direct knock to the eye area. Allergies are another big non-infectious cause. Hypersensitivity to things like pollen, dust mites, mold spores in the air. Often with allergies, you'll see it in both eyes, with maybe more itching and tearing. And eyelid conformation can be an issue too. Things like entropion, where the eyelid rolls inwards, that's more common in foals and the lashes rub the eye, or ectropion, where it rolls outwards.
Okay, so physical things, allergies, how the eyelid sits.
Exactly. And then sometimes conjunctivitis is actually secondary to underlying eye diseases or even systemic problems. For example, it's a really common sign that comes along with uveitis or equine recurrent uveitis, what people often call moon blindness. Less common, but you can see it with keratoconjunctivitis sicca or dry eye, though that's rare in horses. And it can even be a sign of bigger systemic illnesses, especially in foals, like septicemia or pneumonia, or things like African horse sickness in relevant areas.
Wow, so the eye really can be a window to overall health.
It absolutely can. And finally, within the non-infectious causes, we have to mention neoplasia or cancers. Squamous cell carcinoma SCC is a significant one. It commonly affects the conjunctiva, the eyelids, the third eyelid. Certain horses are more at risk, those with pink skin around the eyes, like Appaloosas, paints, some draft breeds. Also, lightly pigmented animals in general, especially with high UV exposure, like at high altitudes.
Okay, that covers a lot of ground on the non-infectious side. What about the infectious causes?
Right, the infectious causes. These include several parasitic infections. There's habronemiasis, which you might know as summer sores. It's caused by stomach worm larvae, habronema, transmitted by flies, usually house or stable flies. They cause these characteristic granular, sort of yellowish lesions, often near the corner of the eye. Warm weather, lots of flies. Those are risk factors. Then there's onchocerciasis. This involves larvae of a different worm, Onchocercus cervicalis, migrating to the eye. It's transmitted by biting midges, culicoids, entheliziasis, or eye worms, caused by Thalasia lacrimalis, adult worms that live in the tear ducts and conjunctival sacs, transmitted by facefly.
Parasites. Okay, what else?
We also see viral causes. Equine herpes virus, EHV1, EHV2, EHV4 can all cause conjunctivitis. Equine viral arteritis, EVA, is another viral possibility. Bacterial infections are quite common, but often they're secondary, meaning something else irritates the eye first, and then bacteria jump in. Common culprits are Streptococcus and Staphylococcus species, sometimes Moraxella equi. Less commonly, you can get mycotic or fungal infections, maybe Aspergillus or Fusarium, and even some protozoal diseases like equine protozoal myeloencephalitis, EPM, can sometimes manifest with eye signs, including conjunctivitis.
My goodness. When you lay it all out like that, it really hits home why you said it's a non-specific finding right at the start. The list is just huge, from a simple speck of dust to parasites to viruses to cancer, and that makes it crystal clear why getting a proper diagnosis from a vet is absolutely non-negotiable here. The treatment must be completely different depending on the cause.
Exactly. It's absolutely critical. Trying to treat without knowing the why, well, you could easily make things much, much worse.
So walk us through that. A horse has a red weepy eye, the vet comes out. How do they figure out which of those many possibilities is the real culprit? What are the key diagnostic steps?
Well, the process always starts with getting a good history from you, the owner. When did it start? Both eyes or one? Any changes in environment? Things like that. Then a complete ophthalmic examination, looking closely at the eye and all its structures. And this exam includes one test that is just absolutely fundamental. It's the fluorescein stain.
Okay, you mentioned this stain before as a game changer. I've heard the term, but maybe not everyone listening knows exactly what it is or why it's so critical. Could you break that down?
Definitely. It's a special orange dye. We put a drop or a wetted strip onto the surface of the eye, onto the cornea, that clear front part. We let the horse blink, maybe rinse excess stain away gently. Then we look at the eye, usually with a special blue light, like a cobalt blue light. If there's any break in the surface of the cornea, any ulcer, basically a scratch, an abrasion, a defect, the stain sinks into the deeper layers that are exposed. And under that blue light, it glows a really bright, vivid green. It's unmistakable.
Wow, okay. So it lights up any damage on the clear part?
Precisely. And knowing whether or not there's a corneal ulcer, that dramatically changes the entire treatment approach. This is probably the single most important message. Certain medications, especially corticosteroids, which are great for inflammation without an ulcer, are absolutely contraindicated, meaning forbidden if an ulcer is present.
Why? What happened?
Because corticosteroids suppress the local immune response in healing. If you put them on an eye with an ulcer, they can stop it from healing, make it much deeper, and dramatically increase the risk of severe infection, potentially even leading to rupture of the eye. But
Oh, wow. Okay. That really highlights why you cannot just guess or use leftover meds. That one test is vital.
it is absolutely vital. Beyond the stain, depending on what the initial exam suggests, we might do other tests. We might take a swab from the conjunctiva for cytology, looking at the cells under a microscope to see if there are bacteria, fungi, or certain types of inflammatory cells. If we suspect bacteria, we might do a culture and sensitivity test, grow the bacteria and see which antibiotics actually kill them. For suspected parasitic issues like hibernamyces, sometimes a small biopsy of the lesion is needed. For eyeworms, sometimes you can actually see the worms or flush them out. And if there's any suspicion of neoplasia, cancer, then a biopsy is essential for diagnosis.
It's incredible how that one simple dye test, the fluorescein stain, acts as such a crucial decision point. It really drives home the need for veterinary expertise.
So, okay, let's assume we have a diagnosis thanks to the vet and these tools. Let's talk treatment. What are the general principles? Things you do regardless of the specific cause. Right. There's some general supportive care that's almost always helpful. Gentle cleaning of discharge is important. Use sterile saline solution or an approved equine eye wash. Don't use tap water or anything irritating. Just gently wipe away crusts or goo from around the eye. Fly control becomes paramount. A well-fitting fly mask is one of the best things you can do. It protects from flies, yes, but also from dust, debris, and even bright sunlight, which can be irritating. Just make sure it fits properly and doesn't rub the eye itself.
Good point about the fit.
Definitely. Environmental management is also key. Think about reducing dust in the horse's stall, maybe wetting down aisles before sweeping, using low-dust bedding options, ensuring good ventilation to reduce ammonia fumes. Controlling flies in the barn area generally helps too. And if the horse seems particularly painful, lots of squinting, maybe head shy, the vet might prescribe systemic pain relief, usually an NSAA like flunixin, maglumin, or phenylbutazone to make them more comfortable overall.
Makes sense. Any other practical tips for owners?
Yes, actually, a simple but effective one is about feeding hay. If possible, feed hay at ground level rather than from elevated hay racks or nets.
Oh, interesting. Why?
Because when they pull hay from up high, lots of dust, seeds, and small bits of debris rain down directly onto their face and into their eyes. Feeding from the ground minimizes that downward shower of potential irritants.
That's a great practical tip. Okay, so that's general care. Now, what about specific treatments once the vet knows the cause?
Right, this is where it gets tailored. For simple environmental irritants or allergies, the first step is, obviously, try to remove the irritant if you can identify it. Then, topical anti-inflammatories can help. Topical NSAIDs like diclofenac or flurbiprofen eye drops can reduce inflammation. Topical corticosteroids like dexamethasone or prednisolone acetate eye drops or ointments are very effective for inflammation, especially allergic reactions. But see, and this is the crucial but,
Only if there's no corneal ulcer, right? Confirmed by the fluorescein stain.
exactly, cannot stress that enough. If there's no ulcer, steroids can be great. If there is an ulcer, they are absolutely off the table. For severe allergies, sometimes vets might also try systemic antihistamines, but topical treatment is usually the main focus.
Okay. What about bacterial infections?
For bacterial conjunctivitis, the mainstay is topical antibiotics. Often vets start with a broad-spectrum antibiotic ointment, like a triple antibiotic containing neomycin, polymyxin B, and bacitracin. If it's not responding or if it looks severe, that's when the culture and sensitivity results become really helpful to choose a more targeted antibiotic.
And the parasites? Hibernamyces, eyeworms?
Parasitic conjunctivitis treatments vary. For hibernamyces and onchocerciasis, the systemic dewormer ivermectin, or sometimes moxidectin, given orally is often key as it kills the larvae. There might also be topical treatments needed for the eye lesions themselves, sometimes including corticosteroids if there's no ulcer, or specific larvicidal drops. Sometimes large Habernema granulomas need to be surgically debrided or scraped away. For thalazziasis, the eyeworms, treatment might involve physically removing the visible worms with forceps after applying a local anesthetic to the eye. Flushing the eye thoroughly can help too. Topical medications, including organophosphates in some cases used carefully, might be prescribed. And again, oral ivermectin can help kill the larvae in adults.
Okay, so different strategies there. What about the other things like eyelid problems or cancer?
Right. For other underlying conditions, you treat the primary problem. If it's entropion, the inward rolling eyelid, That often requires a minor surgical procedure to correct the eyelid position, especially in foals. If it's neoplasia, like SCC, treatment usually involves surgical removal of the tumor, possibly combined with other therapies like cryotherapy, freezing, chemotherapy injections, or radiation therapy, depending on the type and extent. And if the conjunctivitis is secondary to uveitis, well, then the whole focus is on managing the uveitis itself.
It really underscores how crucial that initial diagnosis is.
Mhm.
Now, you've mentioned the steroid warning several times, but it sounds like it bears repeating one more time, maybe as the single most important takeaway for owners handling eye issues.
Absolutely. Let me be crystal clear. Never, ever use old or expired eye medications. Eye meds have short shelf lives once opened and can easily become contaminated. Never use medication that was prescribed for a different horse, or for a person, or for a different condition. What works for one situation can be disastrous in another. And most critically, do not put any ophthalmic medication containing a corticosteroid look for ingredients ending in one, like dexamethasone, prednisolone, hydrocortisone, into your horse's eye, unless your veterinarian has specifically prescribed it for this episode. Andy has performed a fluorescein stain exam to definitively rule out a corneal ulcer. Using steroids on an ulcerated eye can lead to devastating consequences, including loss of the eye. Getting that professional diagnosis before reaching for any tube or bottle is paramount. It's just not worth the risk.
That is such a powerful, clear, and absolutely vital warning. Thank you for emphasizing it so strongly. It really drives home the do no harm principle and the importance of that vet visit. Okay, let's shift gears slightly and finish up by looking ahead. What can horse owners do to try and prevent conjunctivitis in the first place? And what's the general outlook, the prognosis, once a horse has it?
Prevention really comes down to good management practices, many of which we've touched on. Strict fly control is probably number one. Using fly masks consistently when horses are turned out, especially during peak fly season. Using appropriate insect repellents around the eyes, making sure they're safe for that area. Good manure management in barns and pastures to reduce fly breeding sites. All this helps minimize irritation and the transmission of fly-borne parasites like Harbonema and Thalasia.
Fly control, got it. What else?
Regular deworming with an appropriate parasiticide, specifically one containing an avermectin like ivermectin or moxidectin, is key for preventing habronymyasis and onchocerciasis systemically. Stick to a vet-recommended deworming schedule. If you know your horse has specific allergies, try to minimize exposure to those allergens as much as possible, although that can be challenging, obviously. Making sure any underlying ocular diseases like uveitis or systemic illnesses are promptly diagnosed and managed is also important. And for those horses at higher risk of squamous cell carcinoma, the lightly pigmented ones, those with pink skin around the eyes limiting their exposure to intense sunlight, especially during peak UV hours, can help reduce risk. Fly masks that offer UV protection are beneficial for these horses too.
Makes sense. Good husbandry, basically. And what about the prognosis? If a horse gets conjunctivitis, what's the typical outcome?
For most common infectious or simple irritative cases, the prognosis is generally quite good, provided they receive prompt and appropriate treatment based on an accurate diagnosis. They usually respond well. However, if a case fails to respond to initial treatment, or if it keeps coming back, that's a strong indicator that there's probably an underlying cause that hasn't been identified or addressed yet, maybe an allergy, an eyelid issue, or even something like SCC starting.
So recurrence is a red flag.
Definitely. The prognosis for neoplasia, for cancer, really depends heavily on the specific type of tumor, how early it's caught, and how extensively it has invaded the surrounding tissues. Early SCC, for example, can often be managed successfully with surgery and other therapies. Allergic conjunctivitis can sometimes be frustrating because it might require long-term management or be difficult to eliminate completely if the horse can't avoid the allergen. And it's crucial to remember, if the conjunctivitis is just one sign of a larger systemic disease, the overall prognosis depends entirely on the severity and treatability of that underlying condition, which could be quite serious.
So let's try to pull this all together. What's the core message here? It seems like equine conjunctivitis is pink eye in horses. It looks simple, maybe even common. But as we really unpack today, it's actually a symptom, a sign that could hide a whole range of issues, right? From something minor, like a bit of dust, all the way to parasites or allergies, or even serious diseases affecting the whole horse. And it really underscores the absolutely crucial role of the veterinarian, especially that fluorescein test we talk so much about, and why getting the right treatment based on that diagnosis is so incredibly important.
Exactly. And maybe this raises a sort of interesting final thought. What's truly fascinating here, I think, is how the eye really does act as a window. It's not just showing us local problems in the eye itself, but it can reflect the horse's overall health status. Your keen observation as an owner, noticing those early signs and then acting quickly to get informed, help informed by the kind of understanding we've tried to build in this deep dive that can genuinely make all the difference for your horse's comfort and well-being. It encourages us to approach all aspects of our horse's health with that same level of informed curiosity, doesn't it?
That's a fantastic point. The eye is a window and our observation is the key. Well, we really hope this deep dive has equipped you with a more thorough, practical understanding of equine conjunctivitis. Thank you so much for joining us today.